Welcome. Today we're going to talk about something really powerful. That deep and honestly often invisible link between what you went through in the past and how your body feels right now in the present. Have you ever found yourself asking this? You know, that nagging ache in your back or that tension in your neck that just has no clear cause? You've tried stretching, you've tried resting, but it's still there. Well, what if the real story behind that pain started way before the symptom ever showed up? I mean, we're talking about stuff so many of us just live with. Chronic back pain, those killer migraines, digestive issues, or even a shoulder injury that just refuses to heal. We usually blame it on a bad workout, or sleeping funny, or just, getting older. But what if the origin story is actually much deeper than that? Okay, so to really get that origin story, we need to introduce a concept called ACEs. It stands for Adverse Childhood Experiences, and believe me, they have a hidden but seriously profound impact on your body. So what are they? Simply put, ACEs are those really stressful or traumatic things that can happen when you're a kid. It's a pretty broad category, but the main thing is that these events are just overwhelming for a child's brain and nervous system while they're still developing. And this can be anything from abuse or neglect to growing up in a house where there's addiction, domestic violence, or just a whole lot of instability. At the end of the day, it's anything that makes a kid feel fundamentally unsafe or like they have no one to protect them. Now, here's where it gets really interesting. A child can't just process these huge events with their emotions. They're just not equipped for it yet. So what happens? The body takes over. It literally adapts. The nervous system rewires itself for survival, and that constant state of high alert, the fight or flight stress response, that becomes the new normal. It becomes the default setting. And this is where things get really fascinating. Over time, these brilliant survival tactics don't just go away. They actually get woven into the fabric of who we are, and often in ways we don't even recognize. We start to see these deep, ingrained survival patterns not as a response to an old environment, but just as, well, the way I am. We end up mistaking this brilliant adaptation for our core personality. And this right here, this is the big aha moment. That thing you call perfectionism, it might actually be a lifelong strategy to try and earn safety. That people-pleasing habit, that could be a learned survival skill, a loss of boundaries to keep the peace. And that fierce hyper-independence, that could be a protective shell you built because you learned you couldn't rely on anyone else. See? What we label as a personality flaw is so often the body's brilliant survival wisdom. Just let that sink in for a second. These aren't character flaws. They're physiological patterns. And even when our conscious mind moves on or pushes painful memories away, the body keeps the score. It remembers everything. And how exactly does it remember? Through physical symptoms, that constant tension in your shoulders, the tight hips, the clenched jaw. Over time, this becomes chronic pain, digestive problems, and that deep, unshakable feeling of burnout. The unresolved emotional energy literally shows up in the body. Which brings us to a really important question. Why do so many traditional treatments seem to fall short? Why do they feel like a temporary fix? Well, it's often because they're treating the problem in pieces. Think about it. You might go to one specialist for your thoughts and emotions, and a completely different one for your physical pain. But trauma doesn't live in just one of those boxes. It's systemic. It impacts your body, your nervous system, and your emotions all at once. So a fragmented approach is almost guaranteed to be an incomplete one. So the missing link, the real key to resolving these deep-seated patterns, is addressing that body-emotion connection head-on. You have to go to the place where the experience is actually stored, which is in the body itself. And that's where a more integrated approach, like Physioenergetic Therapy, comes into the picture. It's a method specifically designed to bridge that gap and get to the root cause of the issue. So this approach doesn't try to separate the physical from the emotional. It actually bridges physical therapy with a deep awareness of trauma and energy medicine. The whole goal is to help you identify and finally release those emotional imprints that are physically stuck in your body's tissues and nervous system. So how does it actually work? Well, the process is pretty logical. First, you identify your body's specific pain patterns. Then you connect those patterns to your nervous system state. Are you stuck in fight or flight, or maybe in a freeze or shutdown response? From there, you work to uncover the key life experiences that shaped that physiology in the first place. And finally, you work to release those imprints. It's all about getting to the root, not just endlessly chasing the symptoms.
And when you address the true root cause, the changes can be absolutely profound. And we're not just talking about less physical pain. We're talking about more emotional resilience, a higher tolerance for stress, better posture, and even a fundamental shift in how you see yourself. You move from a story of "I'm flawed" to a story of "wow, my body adapted brilliantly to keep me safe."
And for context, this integrated approach was founded by Dr. Gina Calderone, a physical therapist who really saw the need to connect all these dots for true, lasting healing.
So we'll leave you with this thought. Your pain, your tension, your fatigue, they might not be random. They might be part of a much larger story that your body has been holding on to for years, waiting for you to hear it. And maybe the very first step toward healing is simply learning how to listen. So what story is your body waiting to tell?